including increased thirst and hunger, frequent urination, unexplained weight loss, fatigue, blurred vision, slow healing sores, or frequent infections. These could be common signs of diabetes. However, it's important to note that symptoms can vary, and in some cases, especially with type 2 diabetes, people may not experience any symptoms at all. In fact, they may only be diagnosed during routine medical exams. But don't worry, there are ways to prevent diabetes depending on the type. For type 1 diabetes, there's currently no known way to prevent it. Research is ongoing, but because it's an autoimmune condition, prevention strategies are still in development. On the other hand, type 2 diabetes is largely preventable through lifestyle changes. Here are some key steps you can take. First and foremost, maintain a healthy weight. Being overweight is a significant risk factor for developing type 2 diabetes. You can achieve this by focusing on a balanced diet that includes plenty of whole foods, fruits, and vegetables. Opt for lean proteins and whole grains, and limit processed foods and sugars. Regular physical activity is also crucial in preventing type 2 diabetes. Aim for at least 150 minutes of moderate aerobic activity, or 75 minutes of vigorous activity each week. If you're a smoker, it's important to quit. Smoking increases the risk of diabetes and its complications. By giving up smoking, you can significantly reduce your chances of developing this condition. Regular checkups are essential, especially if you're at risk. Regular blood sugar monitoring can help catch the condition early, allowing for timely intervention and management. For women who are pregnant or planning to become pregnant, maintaining a healthy weight, staying active, and eating a balanced diet can reduce the risk of gestational diabetes. When it comes to treatment, it depends on the type of diabetes you have. For type 1 diabetes, the primary treatment is insulin therapy. Insulin can be administered through injections or an insulin pump. It's important for patients to monitor their blood sugar levels regularly and follow a balanced diet and exercise plan to manage their condition effectively. Type 2 diabetes treatment often starts with lifestyle changes, such as diet and exercise. These changes may be enough to control blood sugar levels. If lifestyle changes aren't sufficient, medications like metformin or other oral drugs may be prescribed. In more advanced cases, insulin therapy might be necessary. Gestational diabetes, which occurs during pregnancy, is managed with dietary changes, exercise, and sometimes insulin. If blood sugar levels are not controlled through diet and activity alone. In all cases, regular monitoring of blood sugar levels is crucial to managing diabetes. This allows for prompt intervention if levels become too high or too low. It's also important for diabetes patients to manage other risk factors, such as high blood pressure and high cholesterol, to prevent complications. Remember, diabetes is a manageable condition with the right lifestyle choices and proper medical care. By understanding the symptoms, taking preventive measures, and following the appropriate treatment plan, you can lead a healthy and fulfilling life. Diabetes is a condition that should not be taken lightly. If not managed well, it can lead to serious complications that can have a significant impact on your health. Let's take a closer look at some of the complications that diabetes can cause. One of the major complications of diabetes is cardiovascular disease. This means that people with diabetes are at an increased risk of suffering from heart attacks, strokes, and the narrowing of their arteries. The excess sugar in the blood can damage the blood vessels, making them more prone to constrictions and clot formations. Another complication is nerve damage, also known as neuropathy. The walls of the tiny blood vessels that nourish your nerves can be injured due to excess sugar in your bloodstream, especially in your legs. This can lead to numbness, tingling, and even loss of feeling in the affected areas. Diabetes can also lead to kidney damage, known as nephropathy. If left untreated, this can progress to kidney failure or irreversible end-stage kidney disease. It is crucial to manage your blood sugar levels and monitor your kidney function regularly to prevent this complication. Eye damage or retinopathy is another serious complication of diabetes. High blood sugar levels can cause damage to the blood vessels in your retina, leading to vision problems and potentially even blindness if left untreated. Regular eye Exams are essential in detecting and treating any retinal changes. Foot damage is a significant concern for people with diabetes. Due to poor circulation and nerve damage, the risk of foot complications, including serious infections, is increased. It is essential to take good care of your feet, inspect them regularly for any issues, and seek prompt medical attention for any wounds or infections. Lastly, people with diabetes are more susceptible to skin conditions, particularly bacterial and fungal infections. The excess sugar in the blood can create an environment that is favorable for the growth of these infections. It is important to practice good hygiene. Keep your skin clean and moisturized, and seek treatment for any skin infections promptly. In conclusion, diabetes is a complex and serious condition that requires careful management. However, with the right knowledge and tools, it can be managed effectively. Whether through prevention, making lifestyle changes, or taking medication, understanding how to take control of your health is key. If you found this video helpful, make sure to like, subscribe, and hit the notification bell for more in-depth health content. Remember to consult with a healthcare provider for personalized advice on managing diabetes. Your healthcare provider will be able to assess your specific situation and provide you with the guidance you need to lead a healthy life despite diabetes. Thanks for watching, and stay healthy. Don't forget to like, subscribe, and hit the notification bell to stay updated with our latest tips